Good evening. Thank you so much for joining us. I'm Cynthia Demise. Um, I have been fortunate to be the project manager of the New Pride Agenda for our first year and a half of existence. But I have some new news tonight. So first, we want to congratulate Cecilia Gentili, who has been our board co-chair since our beginning. And Cecilia has recused herself, left the board, and agreed to do our project management for the next 3 or 4 months as we finalize our search for an executive director, which we hope to bring on July 1. So we are spreading ourselves in terms of continuing to do a whole variety of work for New Pride Agenda. Cecilia, many of you know, is a major national transgender activist, brilliant, savvy. We're thrilled to have her input and guidance in our next few months of our evolution. Secondly, we're happy that Ahmed Muhammad has received a promotion at our little emerging New Pride Agenda, and he's now manager for civic engagement and project management. We are thrilled. Will be entirely responsible with our program committee for all these wonderful virtual town halls, which we hold twice a month. I, effective March 1, am going on the board of the New Pride Agenda, and I will be chair of development, so I could help with the development expansion, hopefully grow statewide, which is a huge priority for us. And I will continue, of course, very consciously to help finalize the search and to continue working on a legislative and state advocacy, because that's my comfort level. So we have great structural changes at New Pride Agenda, and we're excited about all of them. Second announcement is that we are working on some advocacy regarding the Equality Act, and we're very pleased to announce that on April 8th, we will have a one-on-one conversation between Cecilia Gentili and Majority Leader Chuck Schumer. A 1-hour show. I think we will have a pretty huge following. We invite you, any of you in New York State, to join. We want to move on the Equality Act. We want it to be successfully passed in DC this year, and that our audience may be even broader than New York State, I expect. So please keep a hold on that night. Last, just quickly, just a personal comment. A number of us were founding members of New Pride Agenda because we really want to focus on transgender, non-conforming, non-binary communities, communities of color, those less resourced. I have been really honored and pleased to learn from so many of you on these virtual town halls. I mean, quite honestly, I end up taking pages of notes, learning from grassroots activists, from our leaders. I have been gifted to have the privilege of helping to see this. And I so appreciate all of you. I happily pass the baton and will continue to do all I can to help and amplify your voices. But you are the leaders now. So I'm blessed, and thank you for the time I've had to share. And with that, take it away, Ahmed.
Thank you, Cynthia. My name is Ahmed Muhammad. I'm a civic engagement public education lead at New Pride Agenda. As a statewide cutting-edge LGBTQ nonprofit, New Pride Agenda has been working alongside queer communities across the state to develop a list of priority policies. These priorities have been informed by a recent survey, as well as our virtual programming series. Among issues of top concern are affordable housing, homelessness, hate crimes, anti-bullying in schools, and income inequality. New Pride Agenda will continue to work with organizations from across the state to strengthen tenants' rights, increase access to healthcare, and continue funding for critical health and human services programs. Today, we are lucky to be joined by some old and new friends who will, in a few minutes, be discussing the upcoming state budget and its impact on LGBTQ New Yorkers. But first, I wanted to flag that a week from tomorrow, Thursday, March 25th, NPA will be hosting an All About PrEP virtual town hall based in the Bronx. Medicare and a couple other local providers will be joining us for a conversation about the benefits of PrEP, resources to accessing HIV prevention medication, and dispelling myths. Councilmember Vanessa Gibson will be joining us, so tell all your friends and keep an eye out for the information. And lastly, we also want this conversation to be as interactive as possible. So please use the comment and chat feature to ask questions and make comments. We have direct access to some of the most influential elected officials and policy wonks in Albany, so don't be shy. And without further ado, I have the great pleasure of introducing tonight's moderator. Kyle Ishmael is a sharp, respected government and politics leader, advancing progressive policies and working to shape the modern Democratic Party. In addition to co-hosting House Party, a top political podcast in New York, Kyle serves as the executive director of the New York State Black, Puerto Rican, Hispanic, and Asian Legislative Caucus and the Manhattan Democratic Party. So a multi-hyphenated genius. So thank you everyone for joining us. I'll pass off the baton. And yeah, hope we have a good discussion.
All right, thanks so much, Ahmed. Thank you, Cynthia. I don't know about genius. That's very, very strong language, but you know what, I'll take it. Also, I will leave it to you guys to figure out who are the old friends and who are the new friends that Ahmed was discussing. My birthday's in a couple days, so I'm feeling more like the old friend, but you know, it's fine. With that, I want to jump into introducing the amazing panelists. I'm incredibly honored to have the opportunity to work with all of these individuals in various capacities in and around government. In no particular order, we are joined this evening by State Senator Jabari Brisport. He represents the 25th Senate District, which stretches over parts of Eastern and North Central Brooklyn. He is also the chair of the Committee on Children and Families in the State Senate. We are also joined by Assembly Member Carmen de la Rosa. She represents the 72nd Assembly District, covering Hamilton Heights, Harlem, Inwood, and Washington Heights. She is chair of the Subcommittee on Infrastructure in the Assembly. We are thankfully also joined by Senator Brad Hoylman. He represents the 27th Senate District, which covers parts of Lower and Midtown Manhattan, and he is the chair of the Committee on the Judiciary in the Senate. We are also joined by his colleague in the Senate, Senator Rachel May. She represents the 53rd Senate District, which covers most of the city of Syracuse and surrounding counties in central New York. She is the chair of the Committee on Aging. And last but certainly not least, we are joined by Matthew McMorrow. He is the LGBTQ State Director in the Office of the Governor. So good evening to all of our panelists. Thank you all for being here. Thank you to New Pride Agenda for putting this together. And of course, thank you for giving me the honor of hosting this discussion. So with that, let's jump right into it. Obviously, the topic of this discussion this evening is around the state budget, right, and how it impacts LGBTQ communities most directly, right? So, you know, I think we all walk into this budget season knowing the kind of fiscal crisis that New York is in. We know that it's a direct impact of the COVID-19 pandemic. But I think, you know, we can all probably agree that there are some very underlying issues that have existed for a while, right? And so this budget season, as all budget seasons, gives those in government the opportunity to address those issues. So I want to start off by simply asking, how do we solve the fiscal crisis that New York State is currently facing in this budget cycle? I want to see who jumps in first before me having to call on anyone.
I'm happy to jump in.
Okay.
All right, Senator Hoylman, how do we fix this fiscal crisis that New York State is in?
Well, I mean, I think in short, we need to both get our fair share from the federal government. And first, let me say, you know, it's just, you know, Kyle, it's great to be here. Your leadership, it's good to see colleagues on this call. It's good to be an old friend of the new Pride Agenda. It was a shame that the old Pride Agenda, frankly, was shuttered. Some of my colleagues never even worked with them, but we felt like they needed to return, and I'm glad that they have. And Cynthia Denise has been an amazing leader, and I'm so excited that Cecilia Gentili is taking over the project management and will be working closely with Ahmed. So that's just wonderful news for the LGBTQ IA plus community. So let me just put that on the table. And there's a lot more work to do. Those people who think that there are not LGBTQ IA plus issues of importance in the state legislature, haven't been paying attention to the disparate impacts of COVID-19 on our community. So we've got a lot of work to do. But I think it's two things, Kyle. It's both getting our fair share from the federal government, as well as raising taxes on those who have the greatest ability to pay, and the very wealthy. And my colleagues know here that we have 120 billionaires in New York City, and I think each of our one house bills reflect that kind of sentiment of needing to raise taxes on the very wealthy. And we can talk about the specifics, but that's the answer. And it's not, and I think, again, my colleagues would agree, it's not a one shot from the feds. That's not going to sustain us through future budgets in future years of necessity. We need sustained revenue to address our fiscal crisis, our public schools, our mass transit, our affordable housing, our seniors, our health care. The idea that we cut Medicaid in our state budget was something that we all rejected very, very strongly. So I'm united with my colleagues in taxing the very wealthy. We can talk about the details, but that's my response.
We'll definitely get into the details a little bit more. Assemblywoman De La Rosa, what are your thoughts on how do you propose we solve the fiscal crisis in New York State?
Yeah, I feel like I'm going to be in good company tonight because I think our answers are going to match up, right? We know that the infusion from the federal government is much needed. We also know that that infusion would have not been possible if a lot of people didn't get together and say, we need to usher in change in Washington. And so this is an opportunity for us to now see the dividends that pays, right? We are in a completely different place than we were under the administration of Donald Trump. And that is just facts. Do we need more? Absolutely. I agree with Brad that we need to make sure that the state has the ability to step up in this budget, to invest in our communities, not only plug holes. And so when I look at the budget, I think that we worked really, really hard to make clear what our principles were, to make sure that the communities that have been impacted by this pandemic are able to get back on track. And part of it is raising revenue in our state. I was a big supporter of Invest in Our New York. I know that many of the colleagues on this call, all of the colleagues on this call are too. For me, I've been focusing a lot on excluded workers. And I was proud to see in the budget that for the first time in the nation, we're going to have a fund for excluded workers. Excluded workers are not just people think it's just undocumented immigrants. No, it's every worker that has not been included in government funding. And I think that when we look at the safety nets that our communities rely on, when we look at food stamps, when we look at the public benefits in the city of New York, we've been overextended in those areas. And so having the state come in and make real investments is needed. And so, I feel proud of the work that we've done, understanding that there's more to do. Now we have to make sure that the things that we have in the budget stick and are augmented in the negotiation process. And so that's where we are. And I think that it's not going to take just one infusion. It's going to take year after year of dismantling a system of inequities that exists in our state.
Thank you. And look, I mean, at this point, we've heard a little bit about the Invest in New York Act. So I'd like to turn to Senator May, for your thoughts on, number one, how do you propose we fix the fiscal crisis in New York? But also, do you think that the Invest in New York Act is the way to go, or some pieces of it, or something else entirely?
So I'm totally supportive of raising revenue. And both houses have come up with their own packages of doing that. I think most of us here wish it had gone farther, but we've got way more to work with than we had last year or the year before. So looking on the positive side, I want to talk about a parallel track that I don't think we talk about very much, which is the invest part of Invest in Our New York. So So I think we have to get away from just looking at the budget as every year we kind of have to put money here, 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 and here, but instead really be thinking of, if we are making targeted investments now, they're going to pay off later on. So my work on the aging committee, one of the things I've really focused on is home care. We have a crisis in home care. We have tens of thousands of people in this state who want to be able to age at home with dignity, but they can't find anybody to come and care for them in their home, to bring them, make them meals or help them dress or any, whatever the things are that they need. And so many of them are ending up going into nursing homes where they don't want to be, and where the Medicaid share of that the state pays is way, way higher than what it would be if we would just invest in home care. So I've been working on multiple prongs of this, and one of them is something that we put in the budget in the Senate One House that I don't think the legislature has ever done before, which was, we said we're going to invest $27 million in getting people off of the waiting lists who are waiting for home care services. And that's going to save us $60 million in Medicaid. So we're investing over here in the aging budget, and we're going to save over here in the health budget more than we're investing in the aging budget. And typically only the executive is allowed to make those kinds of calls. But we decided this year we were going to do it as a Senate and say, look, if we just make this investment, this will be the payoff. I think the more we can do that, I cannot tell you how many people come into my office and say, if we could just spend this money on, you know, whether it's SUNY and CUNY, or whether it's childcare and pre-K or whatever, all the research shows the payoff is 5, 10, 15 orders of magnitude more than the investment is. But we don't get to think that way because we have to do it all in a year-to-year budget, and we don't have a legislative budget office that can say, you know, this is the payoff from doing that. So my commitment, and I know this is kind of a long-term commitment, but is really to get us the tools in the legislature so we can make those kinds of smart decisions that mean that when we are deciding what goes in the budget now, we're also thinking what are the payoffs going to be for years to come. Up here in central New York, people have been leaving for a long time. The population has been pretty flat recently, but it's way, way, way down from what it was 10, 15, 20 years ago. And so every time you raise taxes, people say, oh, you're driving people out of the state. And I say, no. Every time we let our basic social services, our public sphere deteriorate, that's what's driving people out of this state. And if we can invest in making this a state people want to live in, if we can invest in the things that raise our quality of life, then people are going to want to stay and they're going to want to come here. So that's a big investment, but we have to be thinking in the long term about it.
Great, absolutely. And you know, Senator Brisport, if we can get you to comment on not just the question at hand, but also Senator May's point about truly investing in the long term and not just in the short term.
Yeah, I wanted to start by adding on to what Senator May was saying, because when you do invest in preventative care, and preventative care that can be, you know, within the medical field, but you know, you can think of you know, housing, investing in housing as preventative care too. You know, the more you invest in housing, the less you spend in addressing homelessness, or any types of preventative care. And it really is truly, you know, the push to make it a more whole society. So I think, you know, in both houses, we were pushing against any cuts to any social services, because that is a downward spiral. I mean, you start cutting now, you start to you cut in the budget now, you start to degrade New York, it gets worse, and it spirals down. But if we truly invest by redistributing wealth from people who can afford to pay a little bit more to those who desperately need assistance, you can build something much more robust. And just going back to the Investment in New York Act, kind of echoing what Senator May was saying, it's definitely, I think for all of us, what we saw in the One House budgets, not what we were hoping for. it's definitely, I still wanted, to go for the full, 50 billion that we've been advocating for, but it is definitely a better place than we were from the proposals I saw in December, and we've come a long way. And I do know that if we keep pushing, because there's been such great advocacy from my colleagues, from advocates across all of New York State, and it's not April 1st yet, so we have another 2 weeks to keep on pushing and fighting for more.
Thank you, Senator. Matt, I'm curious if you can weigh in and kind of give your perspective, especially from the executive side, specifically on what you think is needed in the LGBTQ community from a fiscal standpoint, right? Like what whether it's programs, organizations, policy that's needed on the state level to address the main concerns of the community.
Sure. Thanks, Kyle. I have to just sort of, I don't know, maintain a certain role here, because I mean, certainly there's a lot of negotiation going on between the executive and the legislative branch right now, and I'm not part of that team that does that negotiation, so I don't want to step on their toes or take a position that doesn't reflect what they're taking. Obviously, I, Matt McMorrow, have my own ideas about things and probably agree with everybody on this call. But I don't want to weigh in on something that's kind of outside of my role in the governor's office. But I mean, honestly, like, I joined the governor's office last May, and it was obviously the middle of a pandemic, and there wasn't a lot. It was not normal times, and when we were sort of developing things for the state of the state and the executive budget, we were told explicitly, do not include anything that has any fiscal attachment to it, because we are broke, and we don't know what the election's outcome will be. We don't know what the what eventual response from Washington will be. I'm grateful by the results of Washington. I'm grateful that that Chuck Schumer is now our Senate Majority Leader, and that help is on the way. But I think going into this, for my entire time in the governor's office, it was always like austerity, austerity, austerity. I think, among my priorities, my wish list, because I'm more of like an internal advocate for the governor's office. Other people make decisions about priorities and the negotiations between the legislature. But I mean, my number one priorities are, maintaining and increasing funding for the LGBT Health and Human Services Network, which is a network of about 70 organizations across New York State that work together to identify the priorities and the needs of the LGBTQ community, that really provide services to them. And in some of the more rural parts of the state are really the only place for LGBTQ young people and others to go and find community. So I think, that's my number one priority. Obviously, I'd love to see more funding for the end the epidemic, more funding for runaway and homeless youth services, which are largely disproportionately populated by LGBTQ young people. So, I mean, those are my personal priorities, my wish list items. I don't get to make the decisions necessarily on my end of the my branch of government, but definitely, like, maintaining those services, because they are lifelines to the people that I'm responsible for.
Thanks, Matt. And I think keeping in along that same line, and thinking about budget priorities, we talked about the respective committees that each of the electeds on this panel are on. I'm curious to know, what issues, what policies, whether they're budget related or not, but what are some of the key LGBTQ areas that you think your respective committee could help to advance, right? So let's start with Assemblywoman De La Rosa. You're on the infrastructure committee. What avenues do you think we have to advance positive LGBTQ policies through that committee? Once you unmute, of course.
Sorry. For those that may be listening and don't know what the infrastructure committee is, it's in a subcommittee of the Corporations and Authorities Committee. And full disclosure, there's no staff. It's just me and, left to our devices on how to advocate for infrastructure across our state. And the way that I've been looking at it is that infrastructure people tend to think about capital projects. People think about new airports, new rail, right? For me, it's about looking at infrastructure in our communities. When we think about the homelessness crisis that is at play in our communities and the homelessness crisis that is going to ensue from what's happening with COVID, we need to look at what the infrastructure, the deteriorating infrastructure in our communities look like to be able to support vulnerable communities. Included in that, obviously, is the LGBTQ plus community. We know that homelessness is something that permeates in the LGBTQ plus community, and it should be something that we address. For example, in my own community in Upper Manhattan, just 2 years ago, we had a major rezoning that happened through the city of New York. And oftentimes development and overdevelopment happens in a way that displaces and causes displacement in our communities without a real lens for investing in the infrastructure, right? How are we building, for example, 60,000 new units of affordable housing without putting in transportation infrastructure to support the families that are coming in, or educational infrastructure to support the children who are going to be living in our community, or healthcare infrastructure that is accessible to all people? And so when I think about my role in that committee, I think about it from an advocacy standpoint, where if we want to leave our mark on the issues that are impacting vulnerable communities, we have to bring it to the forefront of the plans that our state has. So that's how I view the committee. We are obviously part of the Corporations and Authorities Committee that looks at public utilities. We look at the mass transit, the MTA. We've seen how during the pandemic, for example, the MTA has absolutely reduced its services in New York City. And we've seen the homelessness outreach that happens in our train stations. All of those things, in my opinion, are intersectional, right? And when we deal with how to invest in those infrastructure deficits that we have to think about the communities that are impacted. If you're not able to have access to a train station, you're not able to get to work. If you're not able to work, you are increasing the cycle of poverty and underemployment that already exists in our communities. And so that's the way that I look at my committee. I'm one that always thinks about how issues connect with one another and how our advocacy for dismantling the systems that exist is what's going to bring to the forefront progress for communities. So, I sit on this subcommittee. I also sit on the corrections committee. We've been doing a lot of work around, specifically this week, we passed HALT, solitary confinement in the assembly. I know it's coming to the Senate, at a Senate near you in a few days. But also when we think about, the transgender community, we heard on Monday from advocates who have, as trans people, have experienced solitary confinement as a mechanism of keeping them safe while they're incarcerated, knowing that dignity and safety are not interchangeable, and that our state should be using dignity at the forefront of this system and decarcerating rather than increasing the use of solitary confinement. So for me, the issues are intersectional. I look at them through this lens, and I think that in every area that we have the opportunity to insert our leadership and our advocacy, the issues of the LGBTQ plus community should be at the forefront.
Thank you. I want to turn to Senator Brisport and similar question, right? Like you chair the Senate Committee on Children and Families. You've I believe stated that you believe that we should also have a focus on alternative families. I wonder if you can talk a little bit more about the LGBTQ issues that can work its way through that committee, and what a focus on alternative families looks like for you.
Yeah, of course. Thank you, Kyle. So for those who don't know, the Committee on Children and Families focuses pretty heavily on childcare and also foster care. And, when I was appointed to chair this committee, I thought it was pretty important to expand the notion of like, what is a family? Because many people in the queer community, we might differentiate. We have our biological family, and then you might say your chosen family, or there's a term fictive kinships. Not necessarily a biological gathering, but it's still a family. And you could say one way that transpires in the committee is actually it's a Senator Hoylman bill that we moved through committee a few weeks ago, but essentially it was to prevent gender discrimination in family court, to prevent to protect transgendered parents from any discrimination in deciding custody of the child. So it was just ensuring that they would not be discriminated against, or that their gender identity or sexual identity would not be a factor for the judge in choosing who has custody. And I was really happy to pass that legislation. And I want to keep pushing forward to remind us that the notion of what a family is in 2021 is much more broad than what it was 5, 10, or 50 years ago.
Thanks so much. And to Senator May, similar question. You talked about your work on the Committee on Aging, and also being able to take a longer term look at the work that you're doing through that committee. Are there ways that you see LGBTQ issues coming through that committee, and what are some of those?
Sorry. Yeah, absolutely. So there are a lot of issues for older LGBTQ folks. Congregate care is often not welcoming, to say the least. And so people try to avoid nursing homes, but again, the home care issue, it looms large. For LGBTQ folks in nursing homes, there's a lot of discrimination and a lot of kind of going back in the closet, that kind of thing, because the care is likely to be worse for them, and the disparities of outcomes are large. So really paying attention to that. I know SAGE has been working on this issue and had a really great report that came out that really kind of quantified how older LGBTQ folks tend to be in poorer health often because of years and years of isolation and discrimination. And often we find just people with HIV or other kinds of challenges, all those get compounded as people get older. And so they did a report that has an agenda for a number of things to be done, and we've been working on them piece by piece. I also want to mention something that Matt brought up, because I also chair the Commission on Rural Resources. And in rural New York, I think LGBTQ issues, I don't think we pay enough attention to them. And I know we had a hearing 2 years ago that was about the opioid crisis in rural areas, and everybody who spoke said the biggest issue was stigma. And if there's stigma around drug addiction and overdose issues, there's way more stigma around LGBTQ issues, gender identity issues. And so figuring out how you create support networks and systems where people can feel safe bringing up their issues, bringing up mental health issues, for example, that's absolutely crucial. And I don't think we're doing enough of that yet.
So Matt, I also wanted to give you the opportunity, even outside of the budget, to talk through what some of the, just the LGBTQ issues and priorities that you feel that New York should be focusing on, again, whether it's, inside or outside of the budget.
Sure. I mean, it's there's always going to be more work to be done. There are always going to be more priorities, and obviously this past year has informed some of those priorities. I think in the past, several months, even during the COVID crisis, we have continued to build on things. The Department of Health, for instance, just started to recognize and offer a non-binary X gender marker on birth certificates, so that non-binary New Yorkers can amend their birth certificates to reflect their gender identity. And in the State of the State address, the governor included the Gender Recognition Act, which I think is a Brad Hoylman bill, and it's making its way through the legislature. So, I mean, that would
all the best bills are Brad Hoylman bills. You could usually just guess. If it's a great bill, it's a Brad Hoylman bill.
Yeah, Jabari, you got some catching up to do. But I think we, like I said, going into the State of the State, we had about 11 or 12 proposals. We got 4 in there. One was the repeal of the walking while trans ban. Obviously, the state legislature passed that right away, and the governor signed it right away. So, so that's a really important bill that will really affect over-policing of trans women of color, especially. And then we also included, something that Jabari pointed out about prohibiting judges and lawyers from prohibiting family court judges from using sexual orientation or gender identity in child welfare or child custody determinations, as well as removing barriers to infertility coverage and insurance for same-sex, non-binary, and transgender couples who are trying to build a family. And I think also, we also just, legalize surrogacy and streamline the second parent adoption model so that, LGBT couples can form their families. These are all things that are in the works and that are taking place. But, I think the last year we've realized that, we did not count sexual orientation or gender identity in our COVID data. So we don't have a clear picture as to how how COVID has impacted the LGBTQ community. And Senator May, I've met with SAGE and AARP and reviewed their proposals, and I think we've had several initial conversations with SOFA that will, I think bear fruit in the coming months and years, because I think they have some very important information about the disparities that LGBTQ seniors face and how we may ultimately address it. And I know Brad, his bill designating LGBTQ seniors as greatest social need today will help in that effort as well. So I think, working together with the legislature and the executive chamber to really identify the disparities, identify the greatest needs, listening to advocates about the priorities that they're hearing. I think that's really my focus, and I think the focus going forward.
Can I jump in here and just say that one of the bills that we passed in our whole nursing home package was a bill of mine called the Reimagining Long-Term Care Task Force. So creating a task force of experts who would really think out of the box about how we do long-term care, because it's clearly a broken system in New York State. And we very clearly specified that there needs to be representation on that task force of someone with expertise, at least one person with expertise in addressing disparities based on sexual orientation and gender identity. And I think that's really exciting if we can actually get that signed into law and get started on that.
Thank you, Senator. I'd love to turn to Senator Hoylman now with a similar question. In the Judiciary Committee, what opportunities are there to move some of the LGBTQ priorities, through the legislature, specifically through your committee? Once you unmute, of course.
Thank you. Yeah, sorry, I had a 3-year-old who's, as some of my colleagues know, who wanted to go to bed, and I had to leave. I'm sorry about that. I think in the judiciary we have a lot of potential with some great bills that are kind of lined up. There's one in particular that would prohibit family court decisions like child custody, visitation rights, etc., from being made on the fact that the parent is transgender. It's S996. That's a real top priority of mine, Kyle. And, you know, more broadly speaking, I know you've spoken about a lot of the bills I carry, you know, as formally the only LGBTQ member of the Senate. Now I've got Jabari here. It's, you know, Jabari, you're going to find. Yes. And Jabari, you know.
And he's from Brooklyn.
And it's true, because the fact that to have another openly gay man in the Senate is just like such a relief, to be very candid about it. I told Jabari, and I know Senator May probably detects this, but it was worse when we were back in the minority. Sometimes that members lounge feels like a locker room. And I told Jabari the other day, I felt like I was going to get, you know, a towel snapped at me. It's got a clubby atmosphere, and let's just be clear, clubs are usually not places where gay men or people of color or a lot of groups, you know, are comfortable hanging out. And but that family court bill, Kyle, is really one that I want to get passed, and that's probably my top priority in the committee. You know, the other ones, as you mentioned, the Gender Recognition Act, ensuring that schools treat transgender students fairly, covering PrEP and PEP, and authorizing pharmacists to dispense PEP and PrEP. We call it universal PEP and PrEP. An LGBTQ history curriculum. I live just a couple of blocks from an apartment building where, you know, Ed Koch, Larry Kramer, Bella Abzug, and Edie Windsor all lived in the same building. I mean, can you imagine getting in the same elevator as all of them at once? But that is like a locus of LGBTQ history in the village, but it is across the boroughs in the entire state. And we haven't done a good enough job in identifying that for young people so they can feel proud of who they are. And then seniors is such an important issue. It's not in the committee. It's in Senator May's committee. But as you know, designating LGBTQ seniors and seniors living with HIV as populations of greatest social need is a key goal of mine, and happy to say that it passed the Senate today.
Congrats on that win. That's a major one. And I hope you know that your colleagues in the Senate are coming for your bills. It's been stated they're coming for your bills. I wanted to take an opportunity to ask some of the questions that some of the folks watching tonight's debate or panel, I should say, have thrown out, right? So there is a question for Senator Brisport. Would you consider having a hearing on alternative families through your committee?
I love that. Yeah, I would definitely consider. I love that idea so much. We haven't done any outreach to who could be part of that, but please feel free to reach out. I would absolutely love to do that, and would be excited to partner with whoever is interested in speaking at the hearing.
Nice. Another question that we have is with regards to upzoning and, you know, building more multifamily units, possibly in single family zones, right? I think we've touched on a little bit the issue of homelessness and how it impacts LGBTQ communities. We've touched on the older LGBTQ population and their housing needs. Obviously, this one I think is more general and broad, but obviously impacts everybody. So, you know, anybody feel free to chime in on this question, but, you know, what are folks' thoughts on upzoning in an effort to increase, you know, housing options and the housing stock?
I think it's a consideration we should certainly examine. You know, up until now, low-income communities have been the places where the upzoning has occurred. The assembly member knows that, you know, in Inwood, you know, that's a good example. But the truth is that we need more affordability, and every neighborhood has to do its fair share. I'll also say that should not happen at the state level, where we are all state legislators. This needs to be a locally based decision. And then on top of that, you've got 100 million square feet of empty office space in Midtown Manhattan in my Senate district. So converting that to affordable and supportive housing, I think, is an idea that many people have raised, and I think we should pursue it, but we need the city council and the mayor and dare I say the borough presidents to have a big role in that.
Yeah, I think just to piggyback on that, I agree with Brad wholeheartedly. But I also think that we need to look at how upzonings impact communities of color. The burden of upzonings happen in communities of color that are already vulnerable to displacement, right? And that was the issue in Inwood. There was never a racial impact study. There was never a full environmental study that tells us that the 40,000 units of rent stabilized housing, my district has the most rent stabilized housing in the state of New York, are going to become vulnerable because of an upzoning that is not properly planned, right? I also reject the notion that upzonings are the only tools for investing in communities. We need to look at the investment of communities separately from upzoning, right? Because then it's kind of like a pay to play, right? We sell land to developers and then we can invest and then we get nice things. That's not how it should work. We should get nice things because we deserve nice things. And then have a full conversation about how we plan, how we do urban planning and community planning with sustainable avenues for employment, for example. All of the units that are going to be built in my district, none of it is being done with union labor, right? Where my district has over a 50% unemployment rate before the pandemic hit, we're building here, but we're not increasing the employment for people in the district. And so there's a lot wrong with that, but I agree with Brad that, you know, these communities that are so vulnerable shouldn't carry the burden of development.
Yeah, I support building high if you build it affordable, and that people, you know, in the district and the neighborhood can actually live there. You know, from an environmental perspective, density is a good thing rather than sprawl. And I honestly, there are lots of areas that are, well, in New York City, especially, that are wealthy areas that are transit rich, but do not get upzoned. And I can speak directly to where I grew up, Prospect Heights, which was not always a wealthy neighborhood, but is now, you know, we're like post gentrification. It's like we're like in round 2 of gentrification. It's getting super, but no, it's a transit rich area, and a lot of it is just roped off and protected as a historic district, which, you know, I know some people feel some kind of way about, but it lies between 3 major train lines, and it's just a ton of like 3-story brownstones. You know, it can afford a lot more density.
And I think, you know, on this question, Senator May, obviously, as you know, the panelist who is not in New York City, I want to make sure that we're not too New York City focused, but, you know, this question may not immediately be relevant to the Syracuse area, or it might be, correct me if I'm wrong.
I don't even know what upzoning is, I gotta say. Not a word up here.
I think you're probably lucky. That's probably a good thing. But I mean, what are some of the housing related issues that most directly impact your constituents?
So in Syracuse, about 1/3 of the population does not have vehicles. And we don't have public transportation the way you think of it in New York City. We have a bus system, but it is, you know, the buses run maybe once every half hour at certain times a day, and otherwise once every hour or less. It is not something where people can get to, you know, a doctor's appointment, or let alone a job, with the kind of reliability that they need. So public transportation is a huge issue up here, but it's a different issue because we do not have the kind of density that you have in New York City. And so the payoff for increasing the number of bus trips or something like that is very low. And so economically, it's a really hard thing to justify, but in terms of social justice, it's critical here. I literally was in a meeting with a guy who bragged about how he had a worker who was somebody he had brought on as an apprentice, and now he was working there full time, and he was so dedicated to it that he rode the bus every morning, and then he walked 2 miles along these roads that had no sidewalks in the snow to get to work every day. And he was so dedicated to it. And I'm like, well, why don't you just move your business closer to a bus line, for goodness sake? This is not something to brag about. So, transit friendly development is kind of a new concept up here, but we have to do it. Bus rapid transit, that kind of thing. So we're thinking about a lot of those issues, but in the rural areas, there is zero public transportation. And for people, so one of the things that I'm a big advocate for is things like telemedicine, peer-to-peer counseling with, virtual peer-to-peer counseling, that kind of thing, so people can have some of their needs met through other means, so they don't have to be traveling all the time, because it is really hard up here. But I'm a big advocate, and I think a lot of people are moving to Syracuse, young people, because it's a really walkable, livable city if it's done right. And we're about to have a giant infrastructure project with Interstate 81 coming down in the middle of the city, and being able to turn that whole big region right in the center of the city into much more walkable, mixed use neighborhoods. So there's exciting stuff going on, but we have a ways to go to get there.
So I want to try to summarize a question that came through in the chat. Richard Allman was essentially talking about kind of pre-pandemic, right, and some of the issues that the LGBTQ community faces, but highlighting the fact that post-pandemic, or I guess we're still somewhat in it, it's exacerbated a lot of the mental health issues that we all know the LGBTQ community faces at a disproportionate level. So just wanted to get people's thoughts on how government can be more responsive, again, whether that's through the budget, whether that's through legislative means, how government can be more responsive to the mental health needs of the LGBTQ community.
Well, I would say that, we need the data to understand how different public policy impacts the LGBTQ community. I carry a bill that would require LGBTQ data collection. That's currently not a category that agencies collect information on. I think it should be required. California recently passed that. In particular, with regard to COVID and the disparate impact on communities that are lower income or of color, and that is a great proportion of the LGBTQ community. We need to examine that. It also goes to your, data collection. It goes to your earlier question about the Senate Judiciary Committee, and I was remiss in not mentioning, that's something we need to understand is like, who are the judges, making these decisions in courts all across the state? What is their ethnic, racial, sexual orientation? I think we as legislators, particularly senators, have been disappointed by many of the appointments or reappointments that come before us. And there is a need for greater diversity, and we need data to understand that.
I'll add that I guess in my in the Office of Children and Family Services, as we're going through the budget item, this is actually done in the Assembly, but not in the Senate. But now that we're starting to merge the two one houses, I'll be advocating for it. Is allocating funding to help out children who've gone through adverse mental health experiences due to COVID-19. I think is a major health issue. And it just goes back to what Senator May was talking about, just preventative care. You know, you got to help them now to prevent it being worse down the line. And then, you know, I have something that's actually not legislation yet, but I was speaking with a foster care advocate a few weeks ago who was advocating for more mental health training for parents who are in the foster care system, which I love because, you know, I'm always looking for ways to make the foster care system more accessible for queer youth. And, you know, just knowing it's already so hard to come out to your parents, if you add the layer that you're coming out to your foster parents in whatever capacity, you know, making sure that the parents that have chosen to take care of this child have an adequate sense of knowing, you know, mental health needs, I think is something really that's going to be very, very helpful.
I want to also add, a few years ago, I think it was 2 years ago now, I passed legislation to create the Youth Suicide Prevention Council in New York. And that included us, you know, working with the governor's office to create a report on suicide prevention across the state, including looking at demographic data, including the LGBT community, Black boys, Latino girls. Those are the sectors of the population that have an epidemic of suicide in our state. We've seen that, you know, for Black boys, age 9, as early as age 9, we've seen suicide be a huge issue. And for Latina girls, we know that the issues of suicide, you know, at 14, Latina girls were surveyed and 25% of them have seriously considered or planned suicide. And we know that in the LGBTQ plus community, those numbers are exacerbated, right? And so we took a look at what was happening, and we created legislation. The governor signed it into law and has been putting out reports around how we prevent suicide in our communities. And most of it is about having culturally competent care for people in our community. You know, everybody has a struggle, and the people that are providing this care should understand what that struggle is and reflect those communities. And so, you know, it's something we've been working on. And I know that I think it's Member Reyes in the Assembly has a bill that also creates a suicide prevention task force for the LGBTQ plus community, which I support, and I'm looking forward to voting on it in the Assembly.
Yeah, that's a great bill, Assembly Member. I actually wrote the bill.
Okay,
and,
good. There you
yeah,
go. I had a feeling it was yours, Brad.
Well, no, I wrote it with the Assemblywoman, and then
Okay.
Senator Salazar carries it now.
Okay, got it.
She's gotten it passed, and she's
I
a
believe,
strong advocate.
I believe the Senate's passed it, so I think it's on to you, Carmen. To,
Yeah.
But you're right. But you're right, Assemblywoman. I mean, the rates of suicide, and particularly among transgender youth, and I'm very proud that we banned, you know, so-called LGBTQ conversion therapy. It was a Herculean effort to even get that bill, you know, on a committee agenda under the Republicans, which we were unsuccessful in doing. But you know, now with the Democratic majority, it's extraordinary that we can partner with you on these things.
Let me
I like to tell Senator May and Senator Brisport, you don't know how good you have it.
I was going to bring this conversation full circle and say this also comes back to the budget. So ACR Health is the organization that does the most in Central New York for caring for LGBTQ youth who might be homeless or have addiction issues or mental health issues of various kinds. And they had to shut 3 offices and lay off 70 people last summer because the state budget was withholding money from not-for-profits. And we have to figure out a better way to have long-term predictability for some of these organizations that are doing absolutely life and death support for people in our communities. And if they're having to, you know, survive budget to budget, not just survive budget to budget, but then, you know, we award them these grants and other funds, and it takes sometimes years for the state to come through and actually pay on its obligations. And I mean, the state isn't upholding its side of the bargain, even when we are able to get these things in the budget. And then, you know, in the longer term, they shouldn't have to come hat in hand every year. It takes a huge amount of their time to come and beg us for money every single year when the issues are exactly the same year after year. So I wish we could figure out some way to think about our budget differently and take a longer view on it.
I'm always interested in the longer term view, and thank you, Senator May, for taking us full circle on the back to the budget conversation. To wrap this up a bit, I'm curious to know, and we'll start with Matt. You know, for everybody watching this, you know, whether they are advocates, whether they are just, you know, interested New Yorkers on this topic, want to learn more about the budget, want to learn more about you know, how the LGBTQ community is impacted by the budget and by government in general. I'm curious if everyone can share some words on just the importance of engaging as a citizen, right? Like as an advocate, as somebody who is passionate because they are touched by these issues personally. How best can people get involved and get engaged in seeing New York do better by our community? And like I said, I'll start with Matt.
Thanks, Kyle. You know, it's funny, Brad, you brought that up about, you know, conversion therapy. And I remember you know, this is the new Pride agenda. I actually was working for the old Pride agenda and was, you know, working the halls of Albany, trying to get support, trying to cross the aisle with the Republicans and successfully getting some to commit to it, but we never got the bills to the floor because they just refused. And I remember, you know, Brad and I having dinner sometimes and just saying like, what do we have to do to make this happen? And I'm just so excited to return to Albany now and, you know, have another state senator, this one from my own home borough of Brooklyn, Jabari Brisport. Looking forward to working with you more and to have the allies, you know, Assemblymember De La Rosa and Senator May and countless others and a Senate supermajority to just really pass this really important legislation. I mean, that was just 3 bills we were working on back then, and now we can just pass like dozens of bills because they're long overdue. I would say just to advocates, you know, it's important to continue to have these conversations about the issues and priorities that are important to you with your legislators. Also, reach out to me. The executive branch loves to get some heads up about things that are coming down the pike, and we can get some early vetting going through the operations teams and the legal teams. So, you know, so that we can really kind of make this a smooth passage of legislation that's important to all of us. So thank you again, Kyle, Ahmed, and Cynthia for hosting us today.
You're muted.
Whenever you come up, you
All right, well, with that said, we're going to go to Senator Brisport. What are some of the ways that folks can get more engaged on these issues?
You know, I really am going to just go ahead and just plug this advocacy group that hosted this today, the new Pride agenda. You know, I'm sure, you know, they'll send out a way to get more involved with what they're doing, but, you know, it really is about staying, you know, abreast of what we're going to the legislature, but also, you know, what you're doing in your own community. And if you happen to have a, you know, senior center or, you know, a queer center in your community, I'm blessed to have the Stonewall House and Sage in my own district, and I love them both dearly. But, you know, if you can get involved with an advocacy group or like, you know, any queer center in your neighborhood, you should get involved and see how you can plug in and stay chugging along with those.
Thanks. Carmen?
Yeah, I mean, just to add to what my colleagues are saying, I think that many of the changes that we've seen in our state government, in our local governments, in our national, federal government is because of the work of the people power. I think we owe the Democratic Senate majority to the people. And I think that a great way to get involved is just to find out what's happening locally in your own communities. I'm sure that people that are tuning in now are probably super engaged already, but you know, it always works for me when I get the phone calls, I get the emails, right? I don't know about my colleagues, but I know that when I get an email or several on a certain topic, I always print one and give it to my staff and said, look this bill up for me and let me know, you know, why I'm getting so many emails on this one topic, because I really want to be prepped and understand what it is that my communities are asking for. So I think that, you know, reaching out to your elected officials, making sure that you're engaged on the political process on the ground where you live is super important in moving the needle. And I think little by little, you'll see that the people who you sent to represent you in Albany have their hearts in the right place. And we're working really hard to make sure that we're moving the needle for the LGBTQ community. So that's my 2 cents on that.
Thank you so much. Senator May, any kind of closing thoughts for our viewers?
Yeah, I'll just say, as someone who's a relatively new legislator, that we get inundated with information. There's just tons of stuff coming at us all the time. And the things that we remember are the stories. If you're willing to come into a legislator's office or on a Zoom and really tell your story, that sticks with us and makes it much easier for us to sort of keep in mind why it's so important to do what we're doing and to pass legislation that's going to make a difference and to get your priorities in the budget. So I definitely encourage people to get involved that way, to be willing to put yourself out there and say, this is why it matters to me.
Thank you so much. And Senator Hoylman, if you can take us home with your final remarks.
Thank you, Carl, and thanks to all my colleagues. This has been a really good conversation. I would say I would agree with what has been said. Certainly working with the new Pride agenda and working as an organization and power in numbers and being able to go to Albany, that is something that the new Pride agenda organizes. That physical presence, as Senator May noted, connected with, you know, local needs like, you know, the Assembly member and Senator Brisport suggested are so key. I mean, we see examples time and time again, right? Tenants for years came to Albany in massive numbers and buses, and it was a regular event that we looked forward to. And you know what? It paid off. You know, 10 years later, we have passed the most significant rent reforms in state history. And just, you know, yesterday and tomorrow, a group that had been working so hard physically in the trenches, in our offices, telling the stories that Senator May mentioned, the Halt Solitary Coalition, is finally going to reform our solitary confinement laws due to their persistence and sharing those amazing personal stories, those poignant examples, the loss, where they turned essentially pain into progress. And when you're willing to do that, that makes a huge difference. And don't discount actual contact, whether it's email or the postcards. I mean, we've seen in our communities postcard writing campaigns, and we've seen their success. So I would encourage people to send an old-fashioned letter or postcard to a assembly member or senator. In the days with so much email, actually, suddenly postcards are very effective.
Thank you guys. Thank you everyone so much. I want to give my deep thanks to all the panelists. I've learned a ton throughout the past hour, and a huge shout out, of course, to Kyle, our terrific moderator, who's become sort of like a big bro over the past couple of months. I just want to remind everyone that on April 8th, we're talking to Chuck Schumer. And so we need to get the word out. This is about the Equality Act. And although it will help New Yorkers, it surely will help folks in Alabama, across the country, in rural parts of the nation. And so we'll have folks giving testimonials from across the country during the event, and it should be good. This event has been recorded. It'll be on our website over the next couple of days, and I'll make sure to share it around. But I hope everyone has a good St. Patrick's Day evening, celebrate in any capacity, and takes good care of themselves. And hopefully we'll see each other soon. Bye, everyone.
Good to see everyone.
Thanks so much. Good seeing you guys. Thanks, Ahmed.
Thanks, Carl.
Bye,
Everyone.
everybody.
Thanks, Ahmed.
Bye, everyone.
Bye, guys.